Moy. Now let's move on to our discussion today on the Linda Mama program and the strides it has made. And of course, we do know that this is an initiative whose, according to the evaluation, has access improved, but quality care is still low. 80% succumb to suboptimal care, and 70% of the people die outside working hours. The maternal mortality figures are, as you can see on your screen, at least 5,000 deaths per annum. 15 mothers die on a daily basis. Some of the causes of maternal mortality being postpartum hemorrhage, preeclampsia, obstructed labor, sepsis. And of course, the quality of maternal health care now, barely half provide essential obstetric care. 65% access skilled birth attendants. Now, over 500,000 still give birth at home. Over 2,500 cervical cancer cases diagnosed late. And of course, HPV vaccine rollout is termed as slow. Now we're having our discussion on that with Dr. Benjamin Odongo Eli. He's the chair of KOGS, that is the Kenya Obstetricians and Gynecologists Society. Dr. Karibu Sana, thank you so much for joining us today.
Thank
and of
you,
course,
Grace.
we're discussing this program, the Linda Mama, which was launched, by the National Hospital Insurance Fund in the year 2016. Perhaps we could start with the strides that have been made by this program, Dr.
Thank you for having me here. First, I'd like to thank the government of Kenya and commend them on the strides that they have made towards achieving universal health coverage, in particular maternal health. We know with the declaration by the President, His Excellency the President, regarding the free maternity care, and of course the strides that are made by the Beyond Zero campaign, is that we have witnessed an increase in facility-based deliveries. Initially, it was pretty low, but we have hit over 65% of facility-based deliveries. And this called for injection of resources into this program. And that's why we have the Linda Mama initiative, whereby we have the services and financing is offered not on need, not necessarily on the cost basis, but on need basis. Because we know that pregnancy is kind of it's an expected passage in a woman's career, life. So we need to put resources into this aspect of care. So having said that, I would like to just draw us to the statistics from the confidential inquiry on the maternal death. Because the statistics we've indicated there regarding the maternal deaths is from the confidential inquiry into maternal deaths. When do these women die and how do they die? We know our national figures is 362 per 100,000, which means around 5,000 women die every year out of pregnancy and pregnancy-related complications. And this means that around 15 women per day, which is a grim statistic that we need to address. So on the confidential inquiry onto these deaths, we realized that quite a big percentage is due to suboptimal care, such that there's increased access, but the quality that's being offered does not match. We also noticed that most of these women, over 70%, died during outside working hours, from 5 p.m. to 8 a.m. And we know what happens. Some facilities are closed at that time. We have got thin skeleton staff, and those ones who are there are spread thin into various clinical areas. And so these women tend to miss the quality of care that they require, either based on delay in decision making by the healthcare worker, or unavailability of the necessary commodities, or just the incapacity of the healthcare workers to provide the necessary intervention when it is needed.
Mm-hmm. So what do we do to curb these deaths, to even possibly bring them to zero mortality rate?
Yeah, our aim is to try and bring the deaths to to what we see in developed world. And we know that the government has put in a lot of resources into this, and we have got initiatives like the Beyond Zero campaign, which is really trying to address this particular aspect of maternal mortality. But issues that we should address, one, it's a kind of multifaceted approach towards reducing maternal deaths. We can't be waiting downstream to try and address that. We can start from upstream. The simple initiatives, I may call them simple because they look simple, like ensuring that all our women at least visit the clinic in the antenatal period, whereby the complications and their health status can be assessed in good time, and any complications can be mitigated in good time. I would also want to mention human resources for health. By this I mean the adequate staffing and with necessary competence and skill set to address the complications. We should also not forget that family planning plays a big role in prevention of maternal mortality, because the entry point into the path towards maternal mortality is a pregnancy. And if we can prevent it, and we call them prevention of unintended pregnancies, through a robust family planning program and contraception, that can be a better way to see that we reduce our maternal mortality rates.
Okay, talk to us about the 44th Kenya Obstetrical and Gynecological Society Annual Scientific Congress, which we understand will be taking place from Wednesday, the 19th to Friday, 21st February. And of course, this year's theme being sustaining quality reproductive health services at the dawn of universal health coverage, unique challenges, bold solutions.
Yeah, we'll be having our 44th Congress. This is a premier event, the greatest event in our annual calendar, whereby we gather all the obstetricians and gynecologists who practice in this country. And we'll be having our 44th Annual Scientific Congress next week in Diani at Leisure Lodge. And this conference is preceded by 2 days of pre-Congress. And in the 2 days of pre-Congress, whereby we share ideas and share skills and train the gynecologists in areas of interest. For example, we'll have a 2 days pre-Congress on ultrasonography, which is a very important tool. It's actually the eye or the stethoscope of the gynecologist to be able to do obstetric ultrasound scans on site. So we'll have a training for 2 days on obstetric ultrasound scans. We'll also have strengthening the issues of minimal access surgery, whereby we'll have 2 days pre-Congress workshop on hysteroscopy, and also assisted vaginal delivery to help in women who have got delayed delivery during the second stage of the delivery. In the Congress, you have stated correctly about our theme. We want to see how we can put into practice and translate all the research and the papers that will be presented into policy that will be adopted by the Ministry of Health of the Government of Kenya to ensure that we change the practice of obstetrics in this country.
Is it open for all, for the public, or it's obstetricians, gynecologists affair?
Well, the main emphasis really is on obstetricians and gynecologists, but I may say that we also believe in a symbiotic kind of relationship, to be specific about the nurse-doctor symbiosis, because we know that, for example, most of the antenatal care and even deliveries are conducted by midwives and nurses. So it is open to this cadre of healthcare workers. We also have gynecologists in training, we call them residents and registrars, and also any other industry support who may come and showcase the latest equipment and advances in the practice of obstetrics and gynecology.
Maybe as we wrap up and as part of your closing remarks, just talk to us about some of the changes you'd like to see. Just falling back to what we started with, to see a change, to witness a change, especially pertaining those, the mortality rates that we are experiencing.
Yeah, like I said, the main issue is about not only access but also human resources for health. And I believe that we are at a good point whereby we should lobby for Health Service Commission, whereby we have a central way of managing our human resources for health.
Thank you very much, Dr. Benjamin Odongo Eli, the Chair, Kenya Obstetricians and Gynecologists Society. Thank you so much, sir, for joining us. Of course, he was just talking to us more about the Linda Mama program and that conference, the 44th Kenya Obstetrical and Gynecological Society Annual Scientific Congress, which will be held from Wednesday the 19th to February the 21st at the Leisure Lodge in Diani. So that's all the time we had for, that's all we had for you on News Center. Thank you so much for joining us. Of course, do keep it KTN News. I'll be back at 1 p.m. for Weekend at 1 with the latest from what's happening here and beyond. Enjoy the rest of your viewing. My name is Grace Correa.